want to focus again on the African audience, the African population, because I just want to understand this. I think social media it's ubiquitous, right? Like it's all over the world, and we see the problems with that all over the world. And no country is immune to this, I think, misinformation,
That's true.
disinformation
Yeah.
thing. Many places like, Canada, US, UK, we probably thought we were immune to this, but it's not. Like you see how fear and, the lack of information that can leave room for all of these things to grow. Is there something beyond, is there something in addition to that that maybe drives distrust or misinformation in Kenya and Africa, or are you grappling with the same problems that we are?
I think there's also the angle of religion. I think we are
Mm.
more religious than than any other
Well, the
society.
US is a very religious place as well,
Try
it's
as. In fact, in every village there are even like 10 churches, different denomination. I think. I think
okay.
without going further into that, because of our standing about religion, but I think also religion can contribute in a way, because if a church leader comes and says don't take that vaccine, it will take us so many years of so many conversations
Mm-hmm.
with the community to undo that, as long as they
Mm-hmm.
dispute
Mm-hmm.
scientific evidence. And there are times, this is me being very cautious, there are times when science and religion, and it's been documented, don't necessarily agree. So
Mm-hmm.
when I go to the community and ask like, why you not taking the vaccine, they'll say, oh, in my church people tell us not to take this modern medicine. I mean, in a minority of
Right.
population. But yeah, I mean, that people's cultural beliefs, religion sort of also influence the way they process information. And sometimes they tend to rely on what the Bible says or what the pastor says, most of the times what the religious leaders say. And so if the religious leaders contradict science, so we are in trouble. For scientists, we are in trouble there. So we have a whole mix of
Mm-hmm.
things that are contributing, and some of factors that are very unique to our setting, and not to mention socioeconomic dynamics, gender dynamics, and all that stuff as well.
Mm-hmm. So then what do you how I guess, do you have strategies then for dealing with some of these contentious things, like trying to get maybe, those influential people in the village or in the community, like do you go to them to try and convince them, and then they can spread the message? I guess I'm looking for, do you have ideas or strategies or tactics that you use in your science communication in these situations that again then other people could use, around the world?
Yeah, you're right on what you're saying. So we position science in the community. So we take science to the community. We use community radios. We use these community leaders. These are the first people that we use to engage with them about science. So we position our science in a different way. We try to have programs and conversations with the community, and we try to let the community know the kind of work we are doing. So there's a whole body of community and public engagement that helps us to position ourselves in the community, and sort of sometimes use these platforms as ways to try and counter the misinformation that is happening. So our science is no longer you get a grant, run the project, and that's it. Position is get your grant and take the science to the community. Let the community support the work you're doing, understand the work you're doing, and all those engagement platforms also helps us, counter those misinformation, and finding creative ways of communicating science. You can use radio programs, that's for adults. For children, you'll try to use videos, animations, and all that. So science communication is versatile. It gives us all this range of tools that we can tap into depending on the audience that we are engaging with.
Mm-hmm. Yeah, I think that idea of embedding the science in the community. I mean, the nature of your work, you have to do that. I think, kind of what you said at the beginning. The three facets of your work is you need that sort of community. You need it. You need their help, and you're providing help to them, right? Like it's a mutual relationship. So you're really embedded in it. But I think in a broader sense, just the idea of embedding science in communities all over makes more sense. Like this is where people are going to really get that understanding. And I found that in my experience, some of the most fulfilling And I think I don't have data on it, but my idea, my feeling, the most successful science communication stuff that I've ever done was face to face in
Yeah,
person,
yeah.
right? It was at the museum, it was at, whatever it was. And then you can have that conversation, and those people they can see you, they can talk to you, you can see that maybe they're a little nervous to talk to somebody at first because it's like, oh, a scientist, like I'm not going to understand what's going on. There's that intimidation, and then you just have a normal conversation, and they can ask their questions, and they can be heard, and things like that. So I think that's a lesson I think that all of us could take, is that embedding the science in the community where it's done and where it's going to be, applied, kind of thing, right?
Yeah, yeah, that's true. That's true. And their concerns are valid, just even listening to them, I had this vaccine, I got these reactions, I discourage people from taking the vaccine. Trying to
Mm-hmm.
understand, okay, and explaining to them that, these vaccines are good, but for a small, proportion of the population, they're gonna not react well to the vaccine. So when they tell you
Mm-hmm.
their concerns, you should listen, providing that mutual or platform where people can listen, can air their voices, their reservations, and having that conversation without judgment, providing a safe space for them to get feedback to you. I think that's also important.
Mm-hmm. Yeah, absolutely. I think that's a good lesson to take away.